Hey guys, Dr. Ducey here, MTFUcoach.com. We've got a little bit of a positional change here for you tonight. I wrote an article today about man-boobs. I don't really like that word boobs when you're talking about men. You know, that's kind of for the women. Okay, we got to get serious here. We're talking about saggy pec line in men. It's kind of like women calling their glutes buns. Listen, buns are made in the oven, and you eat them, the bread, you get a big gelatinous ass. So let's just, it's a little nitpicky on my behalf, but glutes, pecs, sagging, we want to correct them. I put a little thing up about Lou Ferrigno today, 67 years old, almost 68, no shirt, beautifully maintained pec line, no saggy pecs. And that's a problem with a lot of my members, a lot of friends of all ages. Listen, we've got to distinguish between gynecomastia and just saggy, flabby pecs because of obesity or overfatness. And there's a fine line between that too, because the designation of obesity now is 30 pounds or more over desired body weight. Who knows, that's just a bunch of numbers. When we're talking about gynecomastia, we're talking about swelling of the gland right beneath the nipple. Both men and women have breast tissue. Women it's more pronounced, men it should be barely there. But there's various processes and problems that can cause gynecomastia in men. Newborn babies have high estrogen from their mom sometimes, so about 2 weeks they have a little bit of protrusion of the nipple area. Boys in their years of puberty can have an imbalance of testosterone versus estrogen, and they get gynecomastia, and that can, it's rather embarrassing. Generally it clears up on its own within 6 months to 2 years. It's kind of a long time, but if it is from that imbalance and it's natural, most doctors will just let it run its course. But then we get older guys, and you get older, your testosterone drops, and your estrogen either relatively rises or actually does rise. That causes an actual swelling of the tissue, and that is potentially surgical as far as gynecomastia goes. And when you're taking drugs, a variety of drugs, not just anabolic steroids, sometimes that's an irreversible type of gynecomastia, only corrected by surgery. We're not talking about that here tonight. A lot of my guys, I'm gonna show you me actually. I want to show you what's going on with me. I'm trying to get in good shape right now. Oh, and it hurts the shoulders just to take the shirt off. I've got a problem with my pec line, okay? You may not think so, but I do. You can see there's folds of skin right here. First of all, I want to show you something. Lifting my arms up like this, okay, I can straighten and flatten everything out rather nicely, okay? It looks pretty good like that. Because I'm not beheld by gravity any longer. I'm pulling all the tissue up. Look what happens when gravity comes. It's probably happening to some of you too. I get this skin fold right here. You may not notice it, but I get some fat in my axillary area right here on both sides, okay? And that fat in my axillary area kind of comes and integrates into my lateral medial pec line. So you get this skin right here, and that obliterates, you know, the nice clean line I should have underneath my pecs. Now, as far as leanness with me, I'm starting to get pretty lean now. At the end, you still have residual fat, which are the hardest areas to remove fat. For me, it's my pecs, it's my lower abs, my obliques, and my lower back. I mean, you may not think so, but ordinarily, when I'm really lean, I have veins coming up here. Right now, the only veins I have are top of my feet, top of my hands, and one other area. We won't go there though, but I know my blood flow is still good, so that's what the veins are for. But anyway, getting in better shape, let's say you lose some weight. Let's say you're 50 pounds overweight and you have severe flabby pecs. It's very embarrassing. You go to the pool, you don't want to take your shirt off, you go in the pool with your t-shirt. It's terrible, it's horrible. I'm going to tell you guys, you're too fat. There's no magic solution. It's not chemical. Your diet is not tight enough. You lost 30 pounds, you leaned up in some places, you still have it here. That's not going to go until your diet is tight and you get into the best shape possible. Now, as far as exercises go, and you want to clean this line up right here, you can think in terms of dips, decline dumbbell flies, cable flies. It's all good and fine, but you cannot spot reduce fat. If it is fat right here, it's only going to go once you hit the pinnacle of shape. Right now I'm 12%. I'll lose this skin and a little bit of residual I have. I mean, if you look at the side right here, it looks pretty tight, but look at that right there. Okay, right here, I got abs up here. There's still fat down here. Same thing on this side right here. Okay, and if you look at my back, I have some down here. And again, it may not seem like a lot, but it's enough to blur these lines. It's the details you're looking for. Too many of you guys are looking to just lose a bunch of weight. That's quantitative. I want you to look at it in a qualitative way. Get more quality. Refine yourself. Get down to the bare bones. You've got to work harder. This is not easy. I'm hoping you didn't tune in thinking I was going to talk about a pill or a procedure or a special exercise. There isn't any. It comes down to your food. And if you're eating crap, listen, you can lose weight drinking, drugging, smoking a carton of Luckies, and eating one hamburger a day. Okay, you can lose weight. Cancer will make you lose weight. You've got to do it with whole foods. Chances are your calories have got to go up. And listen, if you're eating too many saturated fats, I'm going to tell you, and even if you're not eating a lot and you think you're getting away with something, that destroys the micronutrients that you need in order for your hormonal processes to work correctly, so your testosterone is high. And that's pretty complicated, but just understand this, you got to tighten things up. You got to harden the fuck up. That's what you got to do. That's all I got to say. And work hard so you can take your shirt off and not feel too bad about it. Your thoughts, questions, considerations, and statements are appreciated. Put them down here. Give me a thumbs up if you think it's warranted. And I'm going to quickly put my shirt back on right now. You have a good night.